Dr. Jones, we talked about TMJ problems, basically the hinges in a person, somehow the teeth are misaligned. You guys also call it a bite not being aligned and not being correct, the teeth not matching the way they should, and it creating headaches, severe headaches, sometimes migraines, neck pain, back pain, shoulder pain, and all type of stuff. Now, I wanted to go into a little bit into the type of treatment which is needed. Like, tell us a little bit how invasive or how not invasive it is to fix it, and what's all needed.
Certainly. First, a thorough diagnosis is acquired so that we can tell, is there a potential for improvement by a dental device, and then if that is determined that yes, this TMJ or pain problem is being caused partially at least by the alignment of the teeth being in malocclusion or misaligned, not balanced, then we make what we call a dental orthotic. A dental orthotic is similar to a retainer, in that it's a very thin piece of plastic that covers the biting surface of the teeth, something that we can, as dentists, can dictate how the top and the bottom feeling of biting together is determined. We do that by taking measurements and using our dental instruments so that when the bottom jaw closes against the top jaw, that the indentations that are in our orthotic are balanced in a way that the jaw joint is seating in its particular home position and not out of joint, as it were, because of teeth that have moved or teeth that have been chipped or missing teeth, whatever the reason, that the jaw is not out of alignment. If we can achieve that, and we can achieve a pain-free environment with the orthotic in place, which is by design from the dentist. We still have not touched any of the teeth yet. We've only placed a plastic retainer-like orthotic device, very precisely made, very precisely adjusted for that particular person, not a one-size-fits-all. And we can remove the pain or greatly reduce it, then we know that at least a large component of the pain that they're experiencing is coming from their misaligned bite, which is pulling their jaw joint away from its desired position. Once we determine that, we can then say that if we can align their teeth or balance the fit of their teeth, it would be a better way to put it, if we can balance the fit of their teeth in the same way it's balanced with the orthotic in place, then the pain should stay away and they should not have it. Every once in a while, we need to realize that not all of the pain is coming from the fact that their teeth are misaligned. But if we can even take away half of the pain, dentally anyway, our patients are really happy about that.
Okay. Now, what about some of the other parts which may play a role? You said that the mouth, the teeth could be misaligned for many reasons. For instance, could it be that you have a problem with your feet, posture, and by doing so it somehow creeps into here, or that the posture goes bad because you're starting here off? Is there some relation, and that there's sometimes other type of specialties, doctors needed to help you fixing the whole thing?
Sure. In fact, there's a phenomenon called muscle recruitment, that if one muscle system is fatigued or if it is being overused, that it will recruit adjacent muscles to then take up more than their share of work in order to help out the muscle group that's being fatigued, and so on, until where a variety of muscle groups might be involved that are far away from the initial problem. So if the problem that I see as a dentist is in the mouth has actually been initiated in another part of the body, I might not be able to take 100% of that away. And there might be something that's going on, with some problem on their feet, or the length of their legs because of a spine out of alignment. I know this. I'm not a spine expert by any stretch, but I do know that there are people whose spine can be out of balance in much the same way that the teeth can be out of balance, and that all works as a unit. That if it's balanced and in place, oftentimes they can avoid pain and suffering because of it. So there might be another component to that, whereas once the teeth component have handled, other components may have now come more to light and might need another practitioner, maybe, a podiatrist in some stages. I know they do similar things with orthotics and shoes. I know chiropractors for habitual spine misalignment, that they can help the patient not only with exercises, but with manipulation to help their spine become balanced and then stay balanced so they don't get back into that the same place that they were in. Several of our patients are seeing both me as a dentist, obviously, and a chiropractor that they regularly see to keep themselves in tune, in balance, and in a much healthier situation.
Right, so basically what you're saying, it's a little bit like, I don't know whether I'm going to make a good example here, but let's just say your blood was somehow poisoned for quite a while, and it has huge cholesterol in it, or whatever it may be. Well, if it was you might fix it, but it touched many other body parts, and weakened them. So you do need to take care of them also. And again, it makes a lot of sense from a mechanical machinery point. You have one cogwheel which has been bad for a while. Replacing that cogwheel alone might not do anything, because by now you had worn out other body parts.
Right.
Your car is a good example, like the feet.
Car is a really good example.
If you have a misaligned tire, so it's like just replacing the tire alone doesn't do you any good. Many other parts go out of alignment because of it, and they then need to be all readjusted. So a person who comes to you sometimes might have to go and see a chiropractor and or maybe a podiatrist. Either way, either one of them will be able to say, hey, you need also that guy or that guy anyway, because they all look at their muscles together. Basically, it's a approach. You've got to fix the whole thing.
It's a fascinating human body that we have, and it's multifaceted, and certainly I will, help anything from the neck up, so to speak, but certainly there's a lot more involved than just dentistry, and I certainly are looking for the total health of all of my patients and realize that there are other professionals who can help their situation.
Great. And again, a person has a headache, and because quite often people with headache have looked at a chiropractor and a physical therapist before and took an aspirin, and if that had little or limited results, or it's kind of like the thing is reoccurring, trip to a right dentist, obviously, because not every dentist fixes that stuff.
Unfortunately,
would be an appropriate thing.
Absolutely. Because we know the headaches can come from a variety of sources, and they might get temporary relief from one source, but if it doesn't stay away, then that means there's other components that need to be examined and then treated. For better or for worse, right? It's just, let's be lucky.
That's the way we are. Yeah, and more the whole medical field, not that they were like really, really bad at it. Nobody's trying to knock them, but more the medical field is willing to work more together. They realize a headache doesn't necessarily come from the head, and a bad heart doesn't necessarily come from the heart, and that's just, because it is a complicated, as you said, it's an intriguing piece of machinery we're having here, no doubt about it.
It's a miracle, you bet. Wonderful.
Dr. Jones, thank you very much. Thanks for giving us your time. Bye-bye.
It's been my pleasure. Bye now.